think there's in most cases, a medical reason why you would choose one or the other. In best case scenario, providers explain the two methods to a woman, and she would decide herself. So the advantages of the MVA are that the procedure is completed and finished within 5 or 10 minutes, and then the woman knows that the abortion is complete. With MA, you take the medication, the first medication, the mifepristone, 24 hours later you take the misoprostol, and then the abortion is complete anywhere from a few hours to a few days later. So it's a process that can take up to a few days. And then in the best practice situation, the woman would come back and be checked to make sure that the abortion is complete. There's not anything remaining in the uterus. And if there is anything, then they would have to have the MVA anyway. So in cases, for example, if a woman's coming in from a rural area, she's only at the provider for a day, it would be a little bit risky for her to take the drugs and then go back to the rural area, and then she has a problem. If an MVA can be done right there, then you know that it's complete and it's done. So some providers prefer it for that reason. They get nervous giving drugs to women, and then they don't know if the women will come back, and they're not exactly sure it'll be 100% effective. And so some providers do prefer the MVA. In addition, in poor countries, providers earn a lot of money from abortion, and they can charge a lot for an MVA. And the medication abortion, well, the drugs are much cheaper. So in theory, it could be offered much cheaper. And so providers have that, in some cases, financial bias. Sorry, Krishna.
There's also the training component. So when we look at it, the reason why we want to try and make ideally both available, we recognize that training on medication abortion is much more straightforward, and training on MVA is a little more complicated.
Isn't there also the timing issue? So you can take MA up to 9 weeks, and then after that is when you can still do MVA or DNC.
That's true.
Yes.
The standard recommendation is up to 9 weeks for the medication abortion, but there's research going on now for use of the medications into the second trimester. So there'll be more data published on that later. But the advantages of the MA, of course, is they don't require a surgeon. They don't require a doctor to perform that procedure. They can be given by midwives or lady health visitors or nurses, as long as there's a referral and counseling done in case the woman has a problem. They need to be able to get to a facility. But the advantages to women, of course, is that in most countries abortion is highly restricted, it's stigmatized, it's illegal, and women don't have access to go and see a doctor for an MVA. And the reality out there in many countries is that they can go to a pharmacy and buy these drugs over the counter and have a safe, private termination at will, basically, for less than $1. And so there's a lot of controversy about this in the medical community because doctors are concerned that women are taking it in the wrong doses. Pharmacies, in reality, pharmacists don't know the right regimens. They don't know how to counsel women. And so there can be a potential for a misuse of the drugs, wrong doses taken, women rupturing their uteruses. So there are risks there. But if you're looking at comparative risk, the risk of taking the medications compared to the risk of what women do otherwise, which is to go to a traditional whoever and put herbs or coat hangers or sticks or whatever to induce an abortion, the risks